Hello friends, are you recently undergoing a root canal treatment or you have finished your root canal treatment and still wondering that was the root canal treatment done correctly or there is something which is not perfect, you're not finding it right, there is some kind of pain, there is some kind of irritation that you're finding even after getting operated. So friends, come, in today's video we are going to know and understand what exactly is done in a root canal treatment. Are everything or whatever the treatment is done, is it really going in a correct direction? And we will know that was your root canal treatment a success or a failure. Come, let us have a look at this today's video.
Subscribe to my channel Dr. Mansi Shah for oral health care related videos and tips.
Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, as you know, I am a dentist and I keep posting up videos related to your oral health. So many of the people just to come and ask me that I got a root canal operated this years back, was it done correctly? Or I am just getting a root canal treatment done. Is it really being done correctly? So friends, come, let us today know how can you gauge that. Now first for that, let us understand what exactly is a root canal treatment and why has your dentist suggested that. So root canal treatment is basically removal of all the dirt, infection from the base, the roots of your teeth. So now your tooth has two parts. The upper portion is the crown portion and the lower portion, which is inside your gums and the bone, which is not seen to you, is the root portion. Now the different tooth has different roots. Like your anteriors, front teeth have single root. As you go on behind, in the premolars you find two or sometimes three, and behind as you go to the molars you might find 3-4 roots. So the more the number of roots, more the time and the cleaning procedure that is required for a dentist. Okay, and what exactly is happening, as you can see, there is a system in which there is a file which can be hand or rotary, and this file just goes inside your root, gets everything out, the infection out, and then what does a dentist do is wait till the all cleaning is done. Maybe if there is multiple sittings, the dentist might just wait at this point, remove the infection and wait at this point. Then in the next sitting, the dentist might just widen and clean all the walls of your root. Again, wait and watch. Then all the sorts of chemicals, you can feel saline, you can feel hypo and some taste which is like bitter and sour in your mouth when this root canal procedure is being done. So all this is a part of cleaning of your root canal. Now as you know, the tooth has blood supply to it. So even if the cleaning is done, the blood supply might just restart, and there are chances that again the bacteria is growing. So we need to pack this empty thing with some material. That is the second step of your root canal. That is packing of the roots, and that is packed with a GP, gutta percha material. As that root is sealed, then the supply, the nerve supply and the blood supply is completely cut down. The tooth then has no sensation left, and it completely is now sealed so that no blood supply comes back and no bacteria grow in. So this is where you actually your root canal is completed, and then you just do packing, and then a crown is placed. Now as you have understood what exactly is done, now let us move to understand why has your dentist suggested you to do a root canal treatment. So friends, it is either from the top, your bacteria and the caries have gone down deep into and caused an infection down. So this infection which is troubling you is what we have to remove and get the tooth healed. Now at times the caries just reaches the upper portion and you start getting that pain, there is that sensation. Sometimes you just neglect that, have medicines, then that tooth goes into the chronic stage, and then later on after a few years maybe the bacteria get triggered up when your immunity goes down, then they give you a good Sometimes there is pus discharge, sometimes there is a cyst formation. The infection has gone, traveled down below the tooth and start digging up the bone below. So this is when, these are the two situations, like in the acute stage and always in the chronic stage, you need root canals treatment. So the basic cause is caries and cavity that has happened and hit your tooth. Then at times, if there is tooth fracture also, and the dentist thinks can be saved, the dentist can suggest you a root canal treatment and a cap. So that will protect your tooth from further damage. Also at times in crack you might have pain, so to combat that pain, dentist will suggest you a root canal treatment. So now we have got two reasons. One is caries cavities, which is in the acute and the chronic stage. The second is crack, which can be, damaging and pain giving. So that's the reason your dentist has suggested you this. So now moving to our topic of how is it going? Is it really going right or it is not going right? The main thing is pain. Has your pain stopped? If yes, then you might just trust the process and know that your treatment is going correct and in the right direction. Is the treatment settings the way of gauging of what has exactly happened? So I would say no, because some dentists do follow a single sitting root canal procedure while the others follow 2 or 3 settings root canal procedure. It does not nowhere depend on the experience of the dentist or the work they are doing. It depends completely on the tooth, where if there is the dentist feels that yes, I'm completely able to clean that and debride everything out, then the dentist might just say and do the setting in single sitting, and some are much more confident in doing a single sitting root canal, so they are completing the procedure, whole complete procedure in one setting. Whereas the other dentist is, feeling that no, there is something which is not properly cleaned yet. There are curved roots which are not properly, getting cleaned. There are more of laterals. The infection was too much and the patient needs more time to heal. And then I'll just seal the tooth. Then the dentist might take up 2 or 3 sittings. Also, I would suggest, according to my experience and study, having and giving time for the tooth to heal is a much more better procedure. So having 2 or 3 sittings for your root canal is always better. Do not insist your dentist to go for a single sitting root canal. It might just come back, the bacteria might just trigger up because you're not giving the time for the tooth to heal and get cleaned properly. So that was my opinion, but then of course you can go and study and have a word with the dentist and see what they have to say. If you have any infection like pus, cyst or something of that sort, has that subsided? Has your pus drain stopped? Has your that bump which has come down below the tooth has settled down? So if that everything is settled down, then also your root canal treatment is going in the right direction. Now how would you gauge that the tooth has been become pain free or infection free? Then that is done between the sittings, that when your cleaning is done, you go off home, the anesthesia has gone off, your dentist is saying that do not eat from that side, please do follow that. You are not supposed to eat from that side, eat from the other side. But even if you're not eating from that side, there is some tingling sensation when you sleep or when you're just working. So if that kind of sensation is there, then yes, the root canal yet needs to be completed. There are some more number of sittings that you need to undergo. Pain is the only criteria which can tell that okay, if the pain has subsided, it is going in the right direction. Also, now I would say that if you are visiting a dental clinic and you are seeing your x-rays, then this is suppose an infected tooth that you can see. Now this is root canal treated x-ray, that is the tooth has been completely filled, done, and the root canal is completely sealed. Then it should look something like this. Now friends, speaking on very professional terms, you are not really able to gauge or judge internally how the root canal is done, because it is other dentist only who can judge and understand the x-rays by learning your x-rays that yes, the root canal was or is perfectly done. So not going much into the deep professional thing, but yes, your roots should look filled, and there's white thing which I'm pointing on the arrow, that should be filled in your roots, and that is how you can say that yes, my root canal has been done and now I'm pain free, and it is okay, now I can fix up a cap on it. So what are the chances of that a root canal can go fail, or why has your root canal gone failed? Please watch this link up and you can gauge on that basis also, that oh, why has that come up again. My one tooth which was done root canal 15 years back is still okay, and one which was done 5 years back is still paining and not doing well. So yes, you can definitely go and judge. Watch this video and you will have the complete idea of how it can be done. So friends, this was a video on how can you judge your root canal procedure is being done right or no, and when can you say a yes to the cap. So if you have any other questions related to your root canals or oral health, do definitely mention it in the comment section below and I'll be very happy to answer it. Friends, I am a dentist practicing in the city of Pune. So if you are having any questions, you can definitely freely come down and we can have a consultation done, and I will be very happy to solve your queries and get you the right treatment. If you are liking my videos, do not forget to like, comment if you have any questions, or if you have undergone a root canal treatment and how painful was the procedure, and also know about if I can make the procedure pain-free for you. Do definitely share it with your friends, and do not forget to subscribe to my channel Dr. Mansi Shah. Stay healthy, stay happy and stay out of it. Thank you.